how do you identify where to start?
Great point. Great point, right? So where do you know, where is this? Well, where is it? Well, let's measure. It's 12 millimeters. So, and I should be able to, if I go in there and at 10 millimeters I perforate, I'm in the right spot, right? So here we gotta make a decision. Do I want to open a sinus? Do I want to add insult to the wound? Maybe I will open the sinus. I don't know, but I'm gonna have everything ready just in case, right? Easiest thing to do is don't do this. Come right here, angle this, and engage this dense bone. Right? Right there, but look how thin it got. If I go back here, it's thicker, but I got less bone. I can either wider implant, maybe shorter implant. So I don't want to be in this space right here because that's hollow. So when I have to go longer, I can go into this space here, right? Your sinus. Big mistake people do is they come too close to this tooth, okay? You took this tooth out. What's in here? Hollow space. You do all your osteotomy, you do all this, and next thing you know, all of this in front of an implant is, if you look at it from this view, you put an implant sideways, you can see all the threads here. You have zero bone implant contact. Now you're hoping for biology to adapt to that rather than have that intimacy. You want to have, so what we want to do is, you want to either go into the socket, right? Or come here, go past the socket here. But look how thin we are here. So that's the decision I'm going to make. So here, we may choose to just possibly put an implant in and just do a 4-3 by 10 minutes. These are all the things that we can do here, but don't sit there for you gotta make the decision within a minute. Don't sit there for 20 minutes trying to figure out what you want to do. Other side, same thing, right? Do I want to be in the central, right? If I'm central, then I have nasopalatal and a facial. If I come here, I have a lot more bone to play with, which would be my lateral. And if I need to, right, we can always tilt the implant and go longer. So that's what I go through with every patient. I go through a consultation, and a week prior I go through it, and if there's something specific I need, I'll let the team know. So make sure I have hundreds of implants, hundreds of multi-units, and then backups, different systems too. Because I need some really narrow implants, 3-3, but I want a solid, strong implant. So I use a Straumann 3-3, right? You can still put a multi-unit on it. It's a strong implant. It's a combination of titanium, zirconium. If I need to do a transsinus implant, then I need a 20, 22, 25, where I lift the sinus, I lift the nose, I start number 3 side, get some stability, go into the sinus, get back into the bone, and hit the lateral aspect of the nose. I'll show you guys the anatomy, right? So some of this stuff becomes, because I don't do zygomas, I rather do alveolar implants. That way, if something ever happens at 10-15 years, they can still go do zygoma implants. So with zygoma implants, one of the complications is chronic sinusitis, right?